So there are sort of three parts to this study. There was an initial index case who had a complete abscopal response, which we then translated into a mouse model, which we then untranslated back into a clinical model in humans. So for the index case, it was a patient with melanoma who had complete abscopal response, concurrent with a flair of Crohn's colitis, which is associated with NOD2 defects. When we did whole genome sequencing, we found a very rare compound heterozygous, so both alleles were dysfunctional in the NOD2 gene. And that, combined with the clinical scenario, was sufficient to generate the mouse model. And we found similar things in the mouse model inoculated with an MC38 cell line, that the mouse responded better, the tumour responded better to PD-1 treatment. And there were some flow cytometry analysis differences between the frameshift and wild type tumours as well, that they had more effector cells within the tumours, which was consistent with the clinical benefit we were seeing. I guess the main study was the prospectively recruited lung cancer cohort, which we recruited all over New South Wales with some very engaged clinicians, selecting out their exceptional responder patients to ensure that we recruited them. And then we did whole genome sequencing on that cohort and found similar findings with more than twice the number of expected NOD2 mutations in patients who did very well with PD-1 immunotherapy.